Yeah, I think in our experience, the key risks that we come across is really about three of them. The first is there just isn't enough labour to go around to service the need into the future. So the risk is how will you get your share of the available pool? That's the first one. The second is then how will you ensure that you get the right ones given the scarcity that's out there? And then that follows up is how do you manage the risks around the people that you have in there? So risks as we see of misadventure. We're in a human services environment and in that space we will have people who act inappropriately. It's a matter of how do you manage that? You can't eliminate it. So that's the three that I see.
And from a governance point of view, how do you think boards can assist with managing that risk?
Well, there's both preemptive and post-adverse event, if you like. I think the first thing is you've got to be very clear about what is unacceptable behaviour in the workforce and therefore what is acceptable behaviour in the workforce. And an example of that with a client that we were associated with, we were having some conversations with staff and we just heard from the staff that they said, it happened to be non-Australian staff, and they said that they just accepted that racism was part of the territory they had to be involved in. And so the message we had back to the board of that organisation was you need to send a message to your staff that you will look after them and you won't accept that, which then created a whole conversation about how do you do that when you can't sanction the people that are in your facility. And someone came up with the answer that they'd had an example of this, and what they did is they told the family member who was acting inappropriately to staff that they were going to be banned from the facility for a month. And the family member said, you can't do that to me. To which they said, well, that's okay. We can call the police now and talk about the behaviour if you like. And so they solved the problem.
Part of it is we've given some advice in relation to using the Enclosed Lands Act as code of conduct for visitors and staff and residents to comply with, and that will give you, if they don't comply with that, gives you the ability to reject them from the facility. Obviously wouldn't do that unless absolutely necessary, but part of that is the conversation about where the boundaries lie, what is appropriate conduct, what isn't. Exactly
right, and you make a good point about having a written code of conduct, because if it's written down, there's no confusion about what that means. When you have conversations, it's like Chinese whispers, it changes after 4 conversations. It has to be articulated, it has to be on the wall and visible.
Yeah, and you need to bring it to the attention of the visitors.
And a culture of speak up when something's happening that's not acceptable. I mean, I can't believe that in all the instances that we've seen in the press recently, that someone else who was working with those people didn't have suspicions that there was inappropriate behaviour.
And I mean, you've also raised an interesting issue in terms of a multicultural workforce in aged care. That's another topic completely, but...
And many of our care recipients in the sector are not used to a multicultural society. They grew up in a time of a much more homogeneous culture in Australia. And so, you know, I look at my own mother. I mean, it was a different era when she grew up, and now she's of an age. And so what was acceptable behaviour then is, by society standards, maybe not acceptable now.
So part of that is education, isn't it? And to actually let them know if you don't want to have a multicultural environment, well, good luck with finding a provider that
absolutely
has only, staff, from a particular area. And there's a lot of, I mean, obviously from me speaking, there's a lot of enrichment in a multicultural society that can make residents' lives richer.
I've often said it, that if I have to go into an aged care facility, I want to go into one that's got a cultural focus. They just seem to have much more life in them.
So, Kristy, what do you consider are the issues with workforce and aged care, and what is Marsh doing that can help approved providers in relation to that?
Yeah, so touching on what Bruce was talking about and the whole concept of safety culture. Because any type of culture, whether it be accepting people's racial backgrounds or accepting safe or unsafe behaviours, is built around what people do and ultimately generations of both acceptable and unacceptable safe behaviours. So it's really important to establish a good safety culture establish systems and processes in order to identify what the hazards and risks are across the organisation or the facility, and go about managing those. While that sounds all really easy, you could have a perfect facility with as many aides and staff numbers as possible, but are people still going to do the wrong thing and potentially injure themselves? Absolutely. So it's all around ensuring that we're encouraging people to be safe, correcting them when they're not safe, but also really rewarding them in really simple ways, just as a thank you or a good on you for doing the correct thing, to encourage them to continue to use the equipment that they've been provided, perform the task in a safe manner, and ultimately be safe and keep others safe around them.
That's a good point that you raise, work health and safety and the aged care workforce. There's a lot of claims and risks in relation to aged care, particularly in relation to manual handling, so assisting our residents get out of bed or go to the toilet, etc. There's issues in relation to personal safety, so aggression from staff, and there's also issues in relation to bullying and harassment, for example, what Bruce was talking about. So what sort of things do Marsh do with their clients to help them manage that?
Yeah, so we have a number of clients in the aged care space, and ultimately do a different thing for every client, because different organisations want different areas, but we can help from managing workers come into the organisation, so through helping with pre-employment medicals and understanding who might be predisposed to an injury, particularly when the predominant workforce in aged care tends to be an older person. They're very caring, so therefore if they're helping someone get out of bed and they go to fall, then their instant reaction is to potentially stop them, and sometimes to their detriment. So we help to identify who might be at a predisposed risk, obviously identify where those risks are, and help clients actually manage them. And that could be through training programs, through safe work procedures, and really working with organisations around behavioural safety to say, how do we do things safely with the equipment and the processes that we've got. And then moving on to, if the worst does happen and a person is injured, then actually helping the injured worker through potentially outsourced return to work programs, and or the employer through ensuring that they manage the claim effectively to get the person back to work uninjured and back to pre-injury duties.
So Sara, in relation to Mirus, what do you consider are the challenges with workforce and aged care, and some of the things that you're doing in relation to that?
Yeah, I think the big one for us has been compliance. So in our workforce management tool, Mirus Works, we've spent the last sort of 12 months putting together our skills management module, and it really helps organisations track the skills of their workers by the role that they work in, and helps manage keeping those up to date and booking in the training that they might require. So I think you mentioned, Kristy, manual handling before, making sure that the employees are all keeping those up to date in the time frame that they're meant to, their registrations, licences, etc. All of that's managed in the tool. And it gives organisations an organisational view of it, but also site by site or wing by wing, so you can really drill down and look even at role-based skills to make sure that your compliance is covered. And also managing those return to work people that have been injured at work, when they come back and do light duties. Our solution helps manage the time that they're allowed to work, and managing the time off as well, showing that leave when they're on the workers' compensation leave, but also when they're working on light duties. So we're really trying to make sure the tools meeting the needs of aged care. I find a lot of the workforce management tools on the market really, because they're multi-vertical, don't necessarily take care of the needs that aged care has. So we've spent a lot of time talking to the industry and working with the industry to make sure that the tools cover those things.
So the tool can be used, for example, like a checklist, making sure everyone's had their police check.
Absolutely. So it's used from onboarding right through the entire life cycle of that employee at the organisation to make sure those skills are kept up to date. And the organisation can plan their training better because they can see they might have 20 employees all coming up to need to do manual handling. So they can book that in for all those employees at once rather than having to send people off singularly as well.